Welcome to Stay Alive with Church Alive. And this is your host, Reverend Dr. Timothy Biirkett, and the proud pastor of Church Alive Community Church and the president of Church Alive Development Corporation. Well, we have a very serious issue here to deal with. And we want to thank Healthcare Education Project for bringing us information and resources that will help us to deal with the issue of the health problem that we have in the Bronx, but not only in the Bronx, but throughout our country. Epidemic situation in the Bronx, people are suffering from diabetes and they're going through a lot of illnesses, and there are answers, there are solutions, there are remedies, but there also are precautions. And we have with us Marcelle Dinnall, and she is the healthcare advocate for Healthcare Education Project Local 1199. We're going to get some information that I had a chance to look at and go through, and I was amazed at the problem and that's growing problem here, especially in the Bronx. And so, without any further ado, I want to introduce my guests to you, Marcelle Dinnall, the healthcare advocate. Thank you for being with us today.
Thank you, Reverend Dr. Biirkett.
Right.
And thank you, Stay Alive with Church Alive, for having me here today to speak about what affects our community. As Dr. Biirkett stated, my name is Marcelle Dinnall. I'm a healthcare advocate with the Healthcare Education Project. We are a community-based advocacy agency. We work in partnership with individuals, clergies, healthcare providers, civic and religious leaders in neighborhoods across New York. We mainly focus on 4 areas. 1, we're always focused on protecting access to critical services in healthcare. Secondly, we also focus on better understanding the urgent healthcare issues facing our communities. And thirdly, we educate our communities about the plight of the uninsured. And fourth, we advocate for universal coverage for all New Yorkers. The Healthcare Education Project is a joint collaboration with 1199 SEIU, United Healthcare Workers East, and the Greater New York Hospital Association. These 2 organizations work together. They're the only unique labor and management initiative throughout New York State, together with our workers and over 250 non-for-profit nursing homes, hospitals, home care providers. And the healthcare education mission is to protect and expand access to quality, affordable healthcare for all New Yorkers. And we do this through education, advocacy, and coalition building.
Well, I'm excited about this program because I had a chance to go through some of the information. And it's shocking, it's revealing, but it's a challenge that we can meet. And I also would like the churches and ecumenically to watch this program with the responsibility that you have to your congregants to deal with the problem of sugar primarily, and sugar that comes in our drinks and the things that we take. Yes. But I want to stop talking because I'm anxious for my audience to go through this PowerPoint that you produced for us.
Sure.
Go right ahead.
Okay, so the first slide that we're talking about today is early detection is the best cancer treatment. I wanted to say thank you to our Governor Andrew Cuomo for providing the funds so women and men could get free breast cancer and prostate screenings free. Yes, that is free throughout New York State. There's a phone number on the slide. We ask you that you can call 1-866-442-2262, where you can find out where is the nearest breast cancer screening in your community. And again, if you don't want to call, you can also text Get Screen to 81336, and they will tell you where there's a screening center close to you.
Well, I'd like to say at this point that Church Alive is having a screening, and our first one, because I feel we're going to have many, and it will be right at our church location. We're blessed to have the mobile unit come out, and it's going to set up there, and we're inviting our senior citizens primarily to come out and get this free screening. And many folk would like to get screening, but it's expensive. And so I want to thank of the services that you have provided to make it possible. And I also say to the pastors out there, make the contact. Have that mobile unit come to your place of worship, and I know God will bless you for doing that. Thank you.
Amen. So I would like to move a little closer to home, right here in the Bronx. Back in August of 2013, the Riverdale Press printed an article calling the Bronx an epicenter of an epidemic known as diabetes. So the Bronx and New York City are positioned at the perilous front of the country's escalating diabetes epidemic. And according to a recent survey published by the New York City Department of Health and Mental Hygiene, 1 in every 3 people in this borough suffers from diabetes. Brothers and sisters, we have to change that. We have to reverse that. The average rate of diabetes cases in Riverdale and Kingsbridge is 7.3%. I repeat, 7.3% according to the survey. And in the Fordham section of the Bronx Park neighborhood, they has the highest rate in the city at 14.6%, while the Chelsea Greenwich area showed the lowest rate of 4.1%. So clearly, this is a perfect example of our zip codes disparities, I'd like to call that. But according to the ADA, that's the American Diabetes Association, the number of Americans with this disease has climbed to 25.8 million. 8.3% of our population. It is still the lowest rate of disease throughout New York City at 10.5. But diabetes, as you know, it's most prevalent in communities of African American and Hispanics, and it's followed by Asians. So again, we have to reverse these numbers, reverse these statistics by taking preventive measures.
Well, this is very close to me, diabetes, because I lost my father and I lost my oldest sister to diabetes. And at that time, the services weren't available as much as they are now. So it behooves folk to really take advantage of these things because it could be one of your relatives.
Yes.
Now, I know we got more to take.
Yes, we do.
Okay.
So adults, 6 in 10 adults in New York City residents are overweight or obese. In low-income communities, 7 in 10 residents are overweight or obese. And sugary drinks are a major contributor to obesity and diabetes. And by sugary drinks, I mean all sugary drinks, those sodas that we love to consume, those juices, even though it says 100% juice, they're not good for us in that form, and many other contributors that has sugar. And in our public school system, children in kindergarten through grade 8 are also overweight and obese, and 4 to 10. And these numbers are frightening as a parent. They're very staggering. And obesity is the biggest controllable risk factor for diabetes. 1 in 8 adults in New Yorkers are diabetics. 3 in 4 adults with diabetes are either overweight or obese. And diabetes causes other illnesses. It can cause you to have amputations. It can also lead to blindness and also kidney failure.
Right. This is the way my father passed the amputation part. They cut off his toes and then it traveled to his foot and all the way to his legs. And I'll tell you, folks, it's a terrible thing to see a loved one just completely deteriorate. But this is happening, and it's happening, and nothing's being done because you could do something about it, but maybe you don't know. Because a lot of people don't know where sugar is found. Help us with that.
I'll be more than happy to tell you that obesity contributes to serious health problems. Diabetes, heart disease, hypertension, stroke, arthritis, even cancer, liver disease, kidney disease, asthma, and the list goes on and on of all these healthcare detriments. And unless we reverse obesity trends, today's children will have a shorter life expectancy, unfortunately, than their parents.
Now, where is the sugar found? Everybody, we talk about in soft drinks. But I'm amazed at some of the other areas.
Yes.
And many of us say, well, I take that. I must be okay. Tell us about that.
So sugar, sweet is added to everything that we drink except water. Any drink with added sugar, and sugar goes by many names, by many fancy names, and we also in the Healthcare Education Project encourages the community to read the label before you purchase that item so that you can know what the content is, what you're putting into your bodies. So it goes by names like fructose, corn syrup, corn sweetener, sucrose, glucose, dextrose, brown sugar, honey, and I know some people love to put a lot of honey in their tea.
You're looking at one right here.
Well, Reverend Dr. Biirkett, I'm sorry to tell you that's also sugar. You'll have to use it in moderation.
Right.
Even maple syrup, Apgar syrup, fruit juices that are from concentrate are loaded with sugar, cane sugar, invert sugar, evaporated cane sugar, or molasses. And again, sugary drinks is also in Gatorade. Sugary drinks, if you are a family member that purchase juices that are 100%, we encourage you to dilute those juices because that also has a high concentration of sugar.
Right. Now, what you're saying now is that the best thing to drink is water.
Yes, and I always say the best drink on earth is water, and most of all, it's free.
Right. Well, most of our body is made up of water.
Yes, it is. But we encourage folks to drink water. And if you have a sweet tooth or you like to have a flavored drink, we encourage you to buy whatever fruits you enjoy having, whether it's strawberries, blackberries, cucumbers, whatever fruit or juice you enjoy, to put it overnight in your water, and you'll be amazed how flavorful and delicious our free tap water is. And beverages account for nearly half of the added sugar in our diets. A typical American consumes 40 pounds of sugar in a year, and that's enough to fill your sink at home. So
Wait a minute, 40 pounds of sugar?
40 pounds that fills your sink at home, yes.
That's shocking.
Yes, but
And
it's
an
true.
awakening, too.
Yes, it is awakening. So what is New York City doing about it? So city agencies has begun to remove soda vending machines from their place of businesses, and at meetings they're offering water. Even at the Healthcare Education Project and with our labor union 1199 SCIU, water is served at our meetings. It's no longer sodas or diet sodas. Diet sodas, by the way, also has sugar inside.
So what I'm suggesting to the pastors out there, when you have your banquets and your dinner and things like that, and make sure you eliminate soda.
Yes.
And an iced tea that you have to use is sugar.
Yes.
And in my church, they can't find these items.
Great. That's
So
great.
all they can find is water, water, water.
Yes.
And it took a while,
Uh-huh.
but they made the adjustment. And folks, that's the key to all of this. We got to make the adjustments.
Yes.
Go right
As the
ahead.
Reverend Dr. Biirkett just stated, pastors, if you're watching, pastoral leaders in your church, please stop making those fruit punches, add in extra sugar. Please stop purchasing sodas and just serve water. And again, you can add fruit, even lemon, and it gives you a nice flavor.
That's true, right? Lemon water.
Lemon water, yes.
Right. I take that in the morning. It helps also cleans out your system.
Yes. And we also have to change during fellowships the type of food that we serve. We have to remove from the fried chicken, macaroni and cheese. We have to serve more
Now
salads.
You're in trouble right now.
Yes, I am.
Right.
I am, but please don't hate me. I'm trying to change the way we do things in our communities throughout New York State. There are healthier choices. We can do grilled chicken instead of deep fried chicken. We can do a pasta salad or a regular garden salad, and we can add fruits to make it even more appetizing.
Fruits and nuts.
Yes.
Okay.
Well, nuts I'm a little leery about because of
yeah?
allergies. Some people may have a nut
That's true.
allergy,
That's
so
true.
I'm a little bit leery about that. And the cookies and cakes at fellowships has to go. And for parents at home, families at home, if you're watching us right now, do purchase seltzer water, fruits that we reiterated, low-fat milk as opposed to whole milk. It's less calories, it tastes just as good, and it's filled with more nutrients than whole milk. So these are little steps that you can take, but again, read the labels for your purchases, whether it's veggies, canned veggies, which we try to stay away from, but I understand sometimes in our communities, that's the only choice we have to purchase canned veggies, but again, look at the sodium content.
Reading the labels, it's really an education. It's interesting. It took me a while before I started reading labels. And then when I started reading them and I saw, 30% this and I said, 30% this?
Yes.
When I looked at the sodium, and I said, I don't believe I was taking all this, all these, what they call potato chips loaded with the sodium.
Yes.
And I just took the bag and threw it back down, And the reading labels is really an awakening.
It is an awakening. Yeah. And also, you should always remember that the first 3 ingredients in any food product that you're purchasing, that's the most amount. So if it starts off with sodium, Wow. You have a
Yeah.
can of salt,
Yeah,
you know?
exactly. All right.
Okay. So next week, our children will be returning to school, and August is National Immunization Awareness Month. And the Healthcare Education Project has been flowering in our community, and we are encouraging parents to make sure that your children get their vaccinations, and it's super important. It builds up their immune system, and it's very important to have that.
Now, if they call the number on the screen that's going to come up,
Yes.
the healthcare
Yes.
education project, and they can give them a location where they can get that.
Absolutely, yes. They call the number and we will ask them for their address, and then we will tell them where's the nearest Department of Health where they can have a free immunization shot if they don't have their own pediatrician.
All right, that's great. Okay.
Yes. Questions?
We have a little time and to deal with that piece of legislation that's coming down from Texas. You want to just expound on that a bit? It's upcoming Texas court ruling
Yes.
that will affect all of us.
Yes, it will. So last September, there were a group of Republicans, Attorney General, that took the Affordable Care Act, the ACA, that is also known as the Obamacare, to court. They felt that the Affordable Care should be unconstitutional. Well, as a healthcare advocate, that is totally absurd from my point of view. So they were in court, and while the hearings were being done, the Healthcare Education Project had press conferences throughout New York State. Because we are not only staff in the Bronx, the Healthcare Education Project staffs all 4 boroughs. We also have staff in Suffolk and Nassau County. We have staff in Albany, Syracuse, and Buffalo. So this program is literally throughout the state. So we held press conferences around the state to educate the community that, if this ACA court case is overruled, we are going to be at a very bad place, because people that suffer with pre-existing conditions like cancer, heart diseases, even a pregnant mother would not be able to get services. And when our former President Barack Obama signed this legislative in 2010, over 95% of New Yorkers got coverage, because New York City have their own exchange. It's known as the Marketplace. And during that period of time, the Healthcare Education Project and stakeholders, we held summits throughout New York State with our healthcare partners, and we were strategizing how we would get our community to be covered with health insurance. And we were doing door-to-door canvassing throughout New York State, yes, during that era. And we were speaking individually to families to find out if they had insurance. If they did not have insurance, we would direct them to the Marketplace. And again, we reiterated the importance of having some form of insurance so that you do not go to the emergency room. When you're not feeling well, you'll go to your private physician, or you do not use the emergency room at our hospitals for a well visit as it used to be.
It's a lot cheaper when you go to your own physician, by the way.
Yes, it is.
But I was smiling because Church Alive was involved with many of the meetings, many of the rallies, and
Thank you.
And we also brought some of our pastors, and they get involved.
Great.
And we've had rallies even at my church to educate our seniors, and that these particular laws are coming down and what they needed to do and how to prepare themselves. Okay. Well,
it's very, very important, and I could not imagine, it's beyond my imagination, that over 12 million people, if the Affordable Care Act was turned down, that there'll be over 12 million people without health insurance. Can't begin to fathom that.
That's unreal.
Yes.
Where are they going to go? We got a health condition here in the Bronx. That's epidemic. So you imagine
all the other boroughs in the states.
And if this situation happens, it's going to be worse than epidemic. It's going to be something really sad that we historicals, he said. That's what I mean.
Yes. And this current administration, along with trying to overturn the Affordable Care Act, also they have proposed a cut of dish cuts to our hospitals. Now, our hospitals survive on dish payments. It's government funding for hospitals that serve low-income residents. So, can you imagine more hospitals being closed or not getting the funding to serve our communities? And right now, the Trump administration has chosen not to renew the dish payments, and they amounting to $12 billion in cuts.
Jesus.
So New York relies on nearly $3.8 billion in dish payments every year, and that $12 billion of dish cuts that are expected to go in effect actually October of this year, October 2019, and starting with the $4 billion cuts. So
Now, we've heard about a lot of things, a lot of education. The question is, what do the average person, what do I do? And what does religious leaders do? And what does program leaders do? We got a lot of leaders, that can come together with healthcare education project and work with you to maximize your effort.
Yes.
And to reach out to the community. And I'm telling all of my pastors and friends and other bishops and leaders that you've got to get yourself involved. You've got to really understand what this information, understand the conditions of your members, and begin to realize that you have a responsibility to God to start advocating. What are the steps? I know there are steps that can be taken.
Well, thank you for bringing up that very important point, Reverend Biirkett. So that's one of the reasons why I'm here, because pastors are the gatekeepers of their congregation, and I believe whatever my pastor tells me. So we were advocating because I personally feel that spiritual health and physical health goes hand in hand, that we need both. We cannot
it's a holistic approach. Yeah,
exactly. So what people can do in the community, they can contact us. We are on the web, the website, Healthcare Education Project. Our website is very interactive. It's very easy. If you don't have access to a computer, you can call the Healthcare Education Project at 646-473-8481. Again, that number is 646-473-8481. We're also on Twitter. The Healthcare Education Project has a Twitter handle. We have an Instagram page. We're on Facebook, and you can also email us if you have questions about anything that has to do with health, or the healthcare dynamics changes so frequently. And if you have concerns or questions, feel free to email us, or you can call us. Someone will take your information, and we will find an answer and try to help you.
Now, what about the pastors out there? I mean, you're working really closely with Church Alive. We're having breast cancer screening. We've done some advocacy work. What can they do?
Well, pastors can invite myself or my colleagues that cover throughout New York State. If they're not part of the Bronx, I'll be more than happy to come and do a presentation and to speak to the congregation. Or so if there's a health ministry at your church, we usually encourage the health ministry to speak to the pastor to have a healthcare Sunday, so that you can incorporate healthcare in your sermon.
Right.
And we also table at churches. We have a lot of endless literature on healthcare and what's happening. Also, if there's community activists in your church, whenever there's an issue with healthcare, we take pastors, community activists, and people that wants to get involved in the community to either Washington or DC to speak to their legislative bodies in person about the issues. And then they need to vote.
Gotta vote. This is the voting season, and if there's ever a reason for you to go out and vote, it is now. And forget about all the other schisms and who's on first, who's on second. The question is your health. And you're going to have to look at that as the number one important reason why you should get out and vote, is because of your health.
Yes.
Now, you've been out in the community, and what has been the response of the community to you and to, because this television program is going to go statewide. Now, what is, and it's probably going further because it's going to be on YouTube and Facebook and all those things. But I wanted to know, what is the response so far?
Well, So thank God, the communities that we serve
Yeah.
have been very receptive to the work on the ground. We work with a lot of pastors throughout New York State,
Great.
and they in turn help us. Whenever we have a situation, whether it's to write a letter to our governor or to our mayor, we depend on our pastors to work alongside with us because our pastors do understand, our people are perishing, and we have to change that.
Well,
And
the perishing because of lack of knowledge.
yes,
But he does say, seek knowledge and get an
yes,
understanding. And that's
amen.
what you're all about.
Yes.
I think it says health care, right? Education
Yes.
project.
Yes.
Educating the community.
Yes, and
And
advocating for the
advocating
community.
It's a
Yes.
combination of both.
Yes.
And but the community is responding good.
Yes, they are. The community is receptive to what we're doing, and we're always looking for volunteers. If there's students out there, college students or high school students that are watching this program right now, please give us a call or reach out to us on Facebook or Instagram if you would like to learn how the healthcare systems work in New York State. You could come work for us.
Fantastic. Now you got
Yes.
job opportunities.
Yes, but it's a volunteer position. It's not a
Right.
paid
Well,
position,
that-
but the knowledge is immensible.
Volunteers mean dedication.
Yes.
I want to just mention that there are a lot of churches out there, folk, and you're having a rally, you're having some special event, or maybe it's your food distribution day or something like that, and I would say to you, like Church Alive, add this dimension to whatever you're doing. And if you need help in doing it, I know that healthcare, amen, education project will be there. And certainly Local 1199, because they've been working with me over the years, folk, and it's made a difference because they bring quality information and the services, and the people who come are dedicated for the health of your parishioners or your neighborhood.
Yes, absolutely. And most of us live in the neighborhoods that we serve, so I think that really shows the authenticity that we're really in this for the long haul because we want the best for our families as well. So we're not just fighting, for our own good. We're fighting for everyone. We want everyone to have health care. We want everyone to have affordable health care. We want everyone to be able to access health care.
Well, we want to thank you.
Thank you so much
This
for having me.
has been a wonderful time having you and sharing.
Yeah.
And folk, all of this is done for you to go to the phone, make a phone call, get the information. This is all about you and us and our relatives, our friends. This is Pastor. This is all about your congregants. And so we have a responsibility now to take this information, utilize it, and I know God will bless all of us. And he said, I would that you prosper and be in good health. That's God's word.
Amen.
We thank you for allowing Church Alive to come into your homes, and we want you to continue to pray for us. And we close by telling you we love you with the love of the Lord. God bless.
Bow down.